We were told dad couldn't go to rehab because he didn't qualify, but no one explained why. Sound familiar? If you've been told your loved one doesn't qualify for skilled nursing care after a hospital stay, you're not alone. And you're not wrong to be confused. I'm Sandra, RN case manager with 20 plus years in elder care. And in this video, I'm going to break down the real Medicare criteria for skilled nursing facility coverage because you deserve to know what's happening and why. When someone hears rehab, they think help walking, help getting stronger, or recovering. And often families think Medicare just covers it because the person was recently in the hospital. But that's not exactly how Medicare works. Medicare doesn't approve rehab because someone looks weak or tired. They approve it based on very specific, documented, skilled needs. So, what counts as a skilled need? Let's talk about that. What actually qualifies as a skilled need is number one, physical therapy or occupational therapy 5 times a week, or a combination of the two to total 5 days a week. Skilled daily nursing care, like IV medications or complex daily wound care. Wound care has to be more than a couple times a week or every other day to qualify. Or number three, new or worsening conditions that require frequent monitoring, like new oxygen, new dialysis, or new seizure medications. If none of these are clearly documented, Medicare might say this doesn't meet criteria. And yes, how it's documented matters as much as what's actually happening. So let me be clear. It's not just about what your loved one needs, it's also about what the doctor, the nurse, and the therapist writes down. For example, if your mom's struggling to walk, but the PT note says tolerated therapy well, progressing, Medicare might view that as no longer needing skilled rehab. It's also essential to know your mom's prior level of function. For example, if mom wasn't walking before, but she used a wheelchair instead, then a walking goal is probably not appropriate. Documentation is everything. Traditional Medicare requires a 3-night inpatient hospital stay before approving SNF coverage. Observation status doesn't count. They have to have been admitted, which isn't necessarily the case just because they were moved up to a floor. And ER visits, they don't count at all. So, managed Medicare plans like Medicare Advantage might have different rules. Some of them don't require a 3-day rule, but they might have stricter criteria, or they might require a pre-authorization. So here's what you can do as a family. Ask early. Will my loved one qualify for SNF based on current needs? This is why prior level of function is important to know. Needed help at home doesn't mean anything. It needs to be specific. Requested therapy and nursing notes reflect the actual level of help needed, like if I need speech, and include the prior level of function for comparison. Clarify with the hospital, is this an inpatient admission or observation status? Again, that makes a difference. If they're denied, ask for written explanation and appeal instructions. No matter the coverage, there are appeal options, and you have a right to know what they are. Remember though, if the documentation doesn't support the appeal, it's not really fair to ask that care be paid for, and the claim will likely be denied at the appeal level anyway. Remind your loved one that their cooperation with the plan of care is essential to qualify for SNF. Patients have a responsibility too, the biggest one being that refusals to participate for any reason could be a reason for an end to skilled stay coverage. If they're in too much pain, for example, you might need to ask for a review of pain medication and ensure that she's being medicated at least 45 minutes before therapy starts. Giving her a pill and then 10 minutes later asking her to participate in therapy is not fair to her. And she has the right to ask that they come back after the medication kicks in. Her therapy is her time, and it's not based on the convenience of the therapist to provide it. If you're wondering about how her pain is being managed and you have legal authority to do so, you can ask to see medication administration records and compare them to when the therapist is approaching your mom to start a therapy session. You're not being difficult, you're being informed. Too many families find out at the last minute that Medicare won't cover what they assumed it would. Or the opposite happens a lot. Hospitals tell patients how long they'll be at a SNF and when they don't have any idea. It's not up to them. They don't know the criteria. And the length of stay depends on the patient and their recovery rate. Could be longer or shorter. We're caring for people here, not a diagnosis code. It sometimes feels like the system failed them because, in many ways, it did. But knowing more can give you the peace of mind that you're asking the right questions ahead of time, which helps everyone feel better in the long run. My goal is not to scare you, it's to arm you with the questions and clarity you need before discharge plan hits your inbox. Download my free caregiver clarity kit at luminalife50.com. It includes checklists, terms to know, and questions to ask while your loved one is still in the hospital. And if you've been denied sniff care and you felt blindsided, whisper, "Me too," in the comments. Or you can visit my website at www.luminalife50.com and schedule a one on one consultation in which I can review your case with you, tell you what questions to ask, and what you can expect in the weeks and months to come. I see you. You're not too late. You're not too old. You're loved just as you are. I'm Sandra, and I'm so glad I get to be on this journey with you. See you soon.